Hey you guys, what's up? Welcome back to What's the 504. I am your host, Christy B. Thank you for checking out my channel. For my new visitors to the channel, please go ahead and subscribe, hit the thumbs up, and hit the notifications bell. And for my returning subscribers, welcome, welcome. So I just wanted to touch on some issues going on in New Orleans because of the coronavirus. Mayor Cantrell is concerned about the deficit and the potential for Sewage and Waterboard to file bankruptcy. So Sewage and Waterboard is the water company that services New Orleans. So I'm going to go ahead. This is courtesy of NOLA.com. And the mayor says that New Orleans faces a $150 million deficit and potential bankruptcy for Sewage and Waterboard. So Mayor Cantrell said the city is now facing a $150 million deficit due to the coronavirus and warned that the Sewage and Water Board could be unable to pay its bills as her administration preps new temporary morgues to handle New Orleans' rising death toll. In a wide-ranging press conference Thursday afternoon, Cantrell decried the federal stimulus bill as leaving out New Orleans, one of the cities hardest hit by the virus in the U.S. She said the Sewage and Water Board could potentially be facing bankruptcy and warned about the massive projected loss in sales tax revenue as a result of rules shutting down bars and restaurants in order for residents to stay at home. The CARES Act, that I believe was launched on March 27th, the $2 trillion federal rescue package intended to provide assistance to individuals and relief to communities amid the economic calamity caused by COVID-19, falls far short of what New Orleans will need to recover from the crisis, and that is a legitimate concern. The law allows cities with more than 500,000 residents to apply for direct federal relief from the impact of the coronavirus. New Orleans falls a little more than 100,000 short of the population needed to qualify. As such, New Orleans will only be able to apply for aid to cover the money it spends directly on battling the virus and not the broader economic impact of lost conventions, shuttered shops, and closed bars and restaurants. For those costs, it will need to share it in allocation given to the state. So guys, New Orleans, the heartbeat of New Orleans revenue is everything tourism, hospitality, restaurants, bars, the Jazz Festival, Essence Festival, Mardi Gras, all of these things, all of these festivities and everything. And of course, you can drink around the clock any time of the day. You can find alcohol, whatever. So this is like a party city, and everything about their revenue relies on these things. So with these stay-at-home orders in place and all of these businesses shut down, that is a huge, huge, huge loss for them. That is a huge loss. I grew up in New Orleans. So I was once a part of the hotel restaurant tourism. I worked at Caris Casino. I worked as a waitress at a couple of restaurants. So this is devastating, and not only just for the businesses, but for the people, the residents. Like, so many people depend on those tips and that money coming in from the casinos, and like I said, from the restaurants, from the bars and stuff. You can make some pretty good cash, some pretty good money. So it's really hurting the city, and it's really hurting a lot of people's income, really, really hurting their income. And I think that it's messed up that they're requiring cities to have a population of at least 500,000 or more. I think they should also take into account the level of devastation that the city suffers. So if the city, predominantly their revenue is based on festivals, tourism attractions, Bourbon Street, restaurant and bars, they're going to take a heavier hit than, per se, a community that might be built on like farming, or let's say like maybe just restaurants. Like I know in Houston, there's big on restaurants. I mean, there's so many cultures to choose from as far as trying new dishes. So in that sense, Houston can still manage to get some revenue because they can do takeout orders and stuff. In New Orleans, that is very difficult to do. The heartbeat of New Orleans is the French Quarters, and that's like the main area where money comes in. So they're having a much harder time with recovering from that. So I think that, there's some flaws within the CARES Act, because New Orleans is going to suffer big time for this. And only providing them with funds that's going to just cover expenses directly concerning the virus, meaning like the temporary morgues that they're setting up, the hospital expenses, any equipment that they've had to purchase, different things like that. But that doesn't make up for all the money that's being lost in the meantime from all the businesses that had to shut down. So that really sucks. Really, really sucks. So I'm going to continue here. It says, that doesn't make me feel like we're cared about if that's all that's going to come down from the federal government to the city of New Orleans. Local governments need to provide essential services and need direct federal support. We're going to be relentless to make sure that the city of New Orleans gets her fair share based on the city being ground zero for the virus. And again, you guys, New Orleans has been heavily hit by this. There's about 18,000 positive cases, and that's among the people who have actually been tested. You have a large population in New Orleans that don't even have transportation. So if they can't make it to the location for the testing, then how many people are out there that haven't been tested that need to be tested? And so, and then, okay, with the stay-at-home order in place, well, if you're sick and you need to be seen, but your only option is to catch the bus, so then what? Now we're passing on, we have a potential, the potential to pass the sickness on, a virus on, if they end up having it and they're having to catch the bus or mass transit, which is the bulk of New Orleans. So many people there catch the bus. So, yeah. So it says the possibility of a bankruptcy for the Sewage and Waterboard was first broached in a meeting Thursday afternoon by Executive Director Gaston Corbin after being asked about how the public utilities' rocky finances were faring. The agency, which was close to running out of money in 2018, had stabilized its finances in part with money from an infrastructure deal Cantrell struck with the city's hospitality industry. In an emailed statement, Corbin stopped short of saying that the agency will be unable to pay its bills, but said he expects many customers will struggle to keep up. He said that while the Sewage and Water Board anticipates a significant drop in revenue, I do not anticipate bankruptcy in the near future. We're seeking funding relief from several sources and will continue to do so in order to minimize the revenue loss we expect in the coming months. New Orleans has been among the hardest hit cities in the country from the effects of the coronavirus, ranking among the top cities per capita for infections and deaths. There are more than 5,240 people who tested positive for coronavirus in the city, and 224 have died. About 30% of both the cases and fatalities in Louisiana are within Orleans Parish. Cantrell said the city had requested 20 refrigerated units to store bodies of those who had died from the coronavirus and currently had 10 supplied by the state setup. The city is also establishing a temporary morgue on the property next to the coroner's office and working on securing additional sites to handle the expected toll of the virus. As of Thursday, there were more than 18,280 Louisiana residents who had tested positive for the virus and 702 fatalities statewide. Wow. See, the last time I read this, I think today's Thursday? I read this on Monday and it was like 500 and something. So they've already added almost 200 deaths to this, and we haven't even made it to the end of the week. City officials also announced that Friday would be the last day of the drive-through test site at the University of New Orleans Lakefront Arena. That site had been one of the first set up under a federal pilot program. That is so crazy because I went to UNO. That program was always scheduled to end on April 10th and has seen a slowdown in use as time has gone on. The city now intends to replace it with a mobile testing program that can target neighborhoods where many residents have not been tested, possibly because of transportation or other issues. The Hilario Center in West Weagle will remain a drive-through test site, and the closure of the UNO facility will allow the shift to resources to other areas of the state where they are needed. The reductions come as both city and state officials have said there are encouraging signs that the virus is no longer spreading dramatically due to the restrictions put in place last month. But those positive signs only indicate that the pace of new cases is slowing, not that the crisis is nearly over. We're nowhere near the end of this crisis, but we are seeing signs that the stay-at-home order is working. However, hospitalizations and deaths are still rising, which means what, people? That means that there are still people out there with these symptoms who are coming to the hospital, I guess, at the last minute, which is what they tell you to do. Wait till you're practically about to croak, or, or you maybe have 2 breaths left in you, then show up at the hospital, which is so crazy. To that effect, both Avegno and Cantrell warned that residents should avoid their usual Easter celebrations and religious services this holiday weekend. Instead, residents should continue to follow the stay-at-home mandate, even in cases where drive-through church services are offered. We understand the sacrifice. The Lord understands as well, Cantrell said. We have to do the right thing and stay the course. So there you have it, guys. I just wanted to give you an update on how New Orleans is being affected financially by the coronavirus. And as I had stated before, they have about 18,000 people who have already tested positive, and New Orleans takes up about 30 to 40%. Really, they're saying 30% now, but it was closer to like 40% when I read a couple days ago. Guys, so I just hope everything get worked out and get the funding that is needed, because I know so many people are being affected by this. I know what it's like living there. I mean, it's already hard enough to find a decent paying job there to begin with. So, oh my gosh, with people being out of work, I just can't even imagine. I can't even imagine. So, you guys, so let me know what you think. Comment below. Let me know what you think. Are you from New Orleans? Are you in New Orleans? Do you have some additional information to add to this that's not being reported? Let me know down below. Okay, so again, thank you for checking out What's the 504. I am your host, Christy B. Don't forget to go ahead and hit the thumbs up, subscribe to the channel, comment below. Let me know what you think. All right, peace.